Kenya remains firmly committed to protecting the lives and future of women, children, through sustained system-wide health reform and accountable delivery. Excellencies, we must also be candid about emerging risks. Recent sharp reductions in global health financing, including support to the United Nations Population Fund Supplies Partnership, threaten to reverse hard-won gains in family planning, maternal care, and birth spacing across our region. Kenya's response is to strengthen supply security through domestic capacity. We are implementing a 40% local procurement requirement to reduce exposure to external shocks. We call on partners, including the Susan Thompson Parvett Foundation, to support risk sharing and bridge financing mechanisms that can stabilize local manufacturing and commodity supply. We are equally committed to strengthening health intelligence. We are moving from broad estimates to precise measurements through the reproductive age mortality survey approach to know exactly who is dying, where, and why. We invite our partners to support accurate implementation and full digitization of this data within a national health intelligence platform. All these measures are anchored in Kenya's National Health Compact for 2026 to 2030, built on the principle of one plan, one budget, and one accountability framework. We appreciate the support of our partners, more specifically, Susan Thompson Buffett Foundation, whose early financial support has accelerated our digital health systems rollout. On behalf of the people and government of Kenya, I want to thank the Susan Thompson Buffett Foundation for stepping forward early to make sure that we work together towards dealing with this emergency. Through the new Social Health Authority, we are expanding prepaid access to maternal care. So far, we have facilitated direct coverage for 50,000 vulnerable adolescent mothers, guaranteeing antenatal, safe delivery, and postnatal services. We are onboarding a further 38,000 mothers to ensure that cost is never a reason a young mother is denied safe childbirth. Financing, however, must be matched by clinical readiness. Under our Maternal and Newborn Health Rapid Results Initiative, we are concentrating resources in 26 high-burden counties and delivering bundled medical equipment directly to last-mile facilities to strengthen emergency, obstetrics, and newborn care. We are also recognizing that system resilience depends on the health workforce. We have trained 720 frontline health workers and deployed 2,880 community health promoters and 192 community health assistants to extend coverage at grassroots level. These teams serve as the first point of contact in our villages and are supported by 25 primary care networks that link local facilities to specialized referral care.
Maternal mortality is one of the clearest tests of leadership on our continent. Every statistic depicts a woman who left home expecting to bring forth life and did not return. Across Africa, we have made commitments to change this reality. The question before us now is whether we are prepared to turn those commitments into results, deliberately and consistently. For Sierra Leone, pregnant women sit at the very center of our health agenda. Maternal survivor is where health systems are tested most severely and where the state's responsibility is most visible. We know that progress is possible, even under difficult circumstances. Over the past decade, Sierra Leone has reduced maternal mortality by more than 70%. This progress did not come by easily. Yet, maternal mortality remains unacceptably high at an estimated 354 deaths per 100,000 live births. That tells us that progress must now be protected and accelerated. We are clear about the causes. Women continue to die from conditions we already know how to prevent. Each death shows us that the system failed somewhere along the chain of care. Across West Africa, evidence shows that when a mother dies, her newborn's chance of survival drops sharply by as much as 7 times in some settings. That reality has shaped how we act. We therefore treat maternal survival as a national responsibility that goes well beyond the health sector.
The young man trekking in the Semin Mountains for a completely different...
His Excellency, President Selassie of the federal...
Claim the 300 days of activism in Sierra Leone, a presidential delivery point.
To deliver this young lady from this extremist pain.
Infant death and 0 dose children.
Africa, regrettably, maternal mortality leaders must translate full dependency on external financing will eventually expose our country. Excellencies, ending preventable maternal death is achieved. But finally, he had to make a choice.